Addictions come in many guises, but substance use disorder may be the most physically and psychologically brutal of all of them. Today on the Elements of Science, learn about the symptoms of substance use disorders, why it's so hard to quit, and what might help pull someone out. Substance use disorder is defined by dependence on a drug, which causes substantial harm and adverse consequences. It develops over time, starting out mild but getting worse if left unchecked. So, how might you differentiate drug use from a substance use disorder in yourself or someone else? A telltale sign is strong cravings for the substance of abuse. Both the brain and the mind want the drug. The brain adapts to its presence and can't function properly anymore without it, and the person craves it intensely as a result. People with an addiction also take the substance in larger amounts or for longer than they intended. They may need larger and larger amounts to get the same effect, which is called developing tolerance. They may even want to completely stop, but often find they can't. They lose control. Even if they know that the substance is destroying their physical or mental health, they may not feel that they can quit. The substance also sucks up a lot of time, and often money. Someone with an addiction invests time in getting and using the substance, as well as recovering from any hangovers or other side effects. And this time must be siphoned from somewhere. This can mean that the addiction starts to take over the person's life, leading to them not functioning well at school, at work, or at home. Substance abuse can also harm relationships for the same reason, especially once the drug has taken priority over social closeness and intimacy. And people may start to give up important activities and hobbies. This makes them heavily isolated, which can feed into their desire to numb the pain with more substance. The drug may also make people neglect safety and put themselves in real danger to obtain or consume it. And perhaps the worst thing about addiction is that the body immediately punishes people who try to quit. Withdrawal symptoms vary between substances and can be anything between uncomfortable and deadly. But someone wanting to quit has to power through withdrawal. And although medical assistance can help, this is a colossal challenge both physically and psychologically. Treatments for substance use disorder have relatively low success rates, although they can work for some patients. Some treatments are pharmacological, but many focus on peer support and therapy. Cravings and withdrawals are part of why addiction is notoriously difficult to treat. But it's also hard to cure because addictions don't happen in a vacuum. Difficult life circumstances dramatically increase someone's chances of developing substance use disorder, and they can also be a barrier to getting better. But there may be better treatments out there. In early-stage clinical trials, the psychedelic substance psilocybin, which is not itself addictive, has shown astonishing success rates for treating some forms of substance use disorder. It may help people address not only their physical symptoms, but also the behaviors, emotions, and life events that contributed to their substance abuse. Research is ongoing to see if psilocybin-assisted therapy will hold up in larger clinical trials. If you're interested in the science behind how drugs affect people, check out the Drug Science program, a science-based course on pharmacology, drug safety, and more. And if you want more elements of science, check out our videos on various substances, disorders, and other topics related to psychedelic research. This has been the Elements of Science. I'm your host, Abigail Calder from the Mind Academy, and thanks to my colleague Selena Hoyza for helping to make this presentation. See you next time on the Elements of Science.